PICO question, pressure ulcers in hospitalized patients. The clinical problem selected in this case is pressure ulcers among hospitalized patients. Pressure ulcers develop mainly in immobilized patients due to the localized skin injury arising from the damage caused to skin cells due to pressure exerted by one lying down for prolonged periods. Therefore, nurses should come up with effective strategies for preventing this occurrence. One such approach is turning or repositioning patients with decreased mobility to relieve the pressure exerted on certain parts of the body. Therefore, the PICO question will be: in hospitalized patients with decreased mobility, P. Repositioning or turning the patient at frequent intervals, I. As compared to not turning or repositioning, C. Will reduce the development of pressure ulcers, O. In 60 days, T. Repositioning and turning of immobilized patients is an evidence-based practice to prevent the development of pressure ulcers. When soft tissues are pressed against the bed for prolonged periods, they are likely to become damaged due to the pressure exerted in the process. Repositioning hospitalized patients relieves the pressure exerted on soft tissues, which prevents damage to the underlying cells. This process ultimately prevents the development of pressure ulcers, as indicated in the PICO question. In relation to nursing intervention, nurses are the primary caregivers involved in interacting with hospitalized patients. In a hospital setup, one of the major roles of nurses is to take care of patients. Therefore, repositioning immobilized patients at regular intervals to prevent the development of pressure ulcers will be a nursing intervention. In the end, this exercise will result in positive patient outcomes because the affected clients will experience better health outcomes. Additionally, the PICO question addresses a central aspect of patient care. One of the main objectives of patient care is to ensure that patients get the best services to improve their health and well-being. Therefore, in hospitalized patients, repositioning them regularly to prevent the development of pressure ulcers will be part of their care. Their stay in the hospital will not be prolonged and they will likely recover easily from the conditions that caused their hospitalization in the first place. In terms of healthcare agencies, hospitals are supposed to create an environment that fosters quick recovery of patients. In this case, immobilized hospitalized patients should be taken care of in a way that does not aggravate their conditions. Pressure ulcers could be termed hospital-acquired conditions because they occur as a result of a patient being in a hospital. Therefore, the PICO question is in line with this concept of healthcare agency whereby hospitals play a central role in the recovery of patients. In nursing practice, nurses are expected to perform various roles, responsibilities, functions, and activities in the process of taking care of patients. In the context of preventing pressure ulcers in hospitalized patients through regular repositioning as indicated in the PICO question, nurses will be executing their roles and duties as covered in nursing practice. Part of nursing practice is the prevention of illnesses even as nurses care for the sick. Therefore, preventing the development of pressure ulcers will be within the framework of nursing practice. In the end, implementing the PICO question will result in improved patient outcomes by ensuring that the affected individuals experience better care outcomes.